Hi everybody, Jackie here with Dr. Bilski of Bilski Family Dentistry. How are you doing today?
Great, how are you?
Doing great.
Good.
So today we're talking about medical dentistry. What is medical dentistry?
Medical dentistry is TMJ, migraine headaches, and snoring or sleep apnea appliances.
So I know about TMJ, but those other two sound like a doctor, and I'm guessing that's where the medical piece comes in.
100%. Medical dentistry does not mean that I'm a physician, and that's really the last thing that I would ever think about
Right.
pretending to be or presenting myself. I'm a dentist. I'm a
Right.
general dentist, and there are certain oral appliances that we can fabricate to reposition the jaw, to relax the muscles, so that your brain chemistry picks up the relaxation and the muscles start to react to the nerves that are responding to the way you're feeling. And there's like this happy time.
Yeah.
All right. So as far as TMJ is concerned, back in the old days when I first started 32 years ago, we would give you something that looked like a football mouth guard that was hard plastic, that was flat, and you just called a bite plane.
Pop it
Okay,
in and-
yeah, it kind of works, and you grind on plastic. There are multiple appliances now, so we're not going
Right.
to get into that, but the principle is to reposition your lower jaw into a comfortable, relaxed position
Right.
so that the muscles here are relaxed.
Instead of grinding and pressing. And,
Correct.
Yeah.
So that's the TMJ. Now the migraine part of it is part of the muscles of mastication. So there's a main nerve, the fifth cranial nerve. That's a test question on all dental examinations. They have three divisions. It goes to near the eyes, the upper jaw, and the lower jaw.
Okay.
Okay? So that's why dentists and neurologists can take care of that, but neurologists cannot help that nerve when the muscles and the bite and everything's off. So we balance the bite is what we're talking about,
Yeah.
which balances the jaw, which relaxes the temporals, which relaxes the shoulders and the upper back and the neck.
And it can help the migraines because, as you said, that nerve kind of goes all the way through.
So we have what are called dental mandibular rehab therapists,
Okay.
DMRTs.
DMRTs.
And that's just like a masotherapist, but only from the shoulders up.
Up.
And then we use cold laser, which is a red light. We use ultrasound, massage, and exercise. And depending on the severity,
Right.
however many appointments you need, all done in our office.
Wow.
So that's that medical part. So we have a program
Wow.
in our practice that we know how to identify,
Right.
but we also want the physician to assess their patient.
Right.
So they
Work
don't have
in collaboration.
Yeah, we don't want to have a subarachnoid hematoma, which
Sure.
I'm treating for a headache because I think it's TMJ, and they have a problem.
And they have an actual problem going on.
Yeah.
So you want to make sure that the physician says it is this nerve, it is something you might want to consult a dentist
Yep.
to work on relaxing your jaw,
So our
working through these
collaborative
therapies.
Yes, it is, and it's all done, and doctors like to check boxes and forms. It makes it a lot quicker for us. So we have a form in our practice. It's called
Okay.
for COSH,
Easy.
Center for Oral Systemic Health, and we give them our COSH sheet. I write down what I think they have, not diagnosing.
Right.
Please evaluate for this, and then return the patient back if you feel. Now,
So they take that to their doctor and fill it in and go from there.
it's just a nice way of, like we talked earlier, if we're going to go to Spain, I'm not going to speak Japanese.
Right.
We'll speak Spanish. So that we're talking doctor now.
Yeah.
And then that doctor has the ability to talk dentist to me.
Yeah.
Now, when we go into the snoring,
Right.
we have to assume sleep apnea or hypopnea, either
Yep.
clearly stopping breathing or just kind of holding your breath but breathing, which
Right.
creates all kinds of other medical problems.
Yes.
High blood pressure, heart disease, increased diabetes. It's all over the place. So when we recognize, or a wife may say, could you check my husband and give him one of those snoring appliances? It's a different type of form. We check that out and have your sleep evaluation.
Yep. Which is
And
done
then-
at a physician.
Right, and the physician will say, yep, you nailed it, doc. This woman or this guy needs a CPAP,
Yeah.
which is the mask
Right.
or the pillows or the ear nose contraptions. And a lot of patients are claustrophobic.
They don't want to do that.
So they try it, it's noisy, they have to sleep in another bedroom, and they're still in it with their wives or their husbands, and it's like, it's not very sexy. What else can you do?
Is there another option?
There's another option. And so just so if you're watching this vlog right now, you understand
Yeah.
it's the second line
Right.
after CPAP. So if you're non-compliant with your CPAP or BiPAP, there's a box on there, and I check that patient's non-compliant, they're claustrophobic, evaluate for oral appliance therapy, and then the doc looks and talks to the patient. They come back to me, and then we make our mouthpieces. And it's seamless, but now I have an understanding what the physician's trying to do, and then we do what's called titration. So there's an adjustment on the snoring appliances that we can dial it in, and the way we know is like my wife said, I'm fine, I don't snore anymore.
Great.
That's where it's done. Oh, by the way, all right, now that we got you where you are, you need to go back for your second sleep evaluation. So now we're talking physician, dentist. There's no, what's he trying to do or what's she trying to...
It's clear communication. It's clear collaboration. So medical dentistry is where a dentist has options, has appliances for migraines, for TMJ, and for sleep apnea circumstances where you can work in collaboration with physicians to come up with great solutions for patients that are dealing with these issues.
You got it.
All right, so if you are dealing with sleep apnea, TMJ, or migraines, you may want to consider talking to your dentist or talking to your physician about consulting a dentist. And Dr. Bilski has done a lot with medical dentistry. He has great sleep apnea appliances. You can learn about them in some of our other videos. And so if you have any of these medical issues and you want to talk to Dr. Bilski's office, call them today to schedule your appointment at 216-524-4410 or visit them online at bilskidds.com. You can also drop by their offices to schedule your appointment right off Rockside Road in Independence, Ohio. Thank you so much, Dr. Bilski, for talking to us about this.
My pleasure.